My name is Bill Keck. I'm chair of the Academic Health Department Learning Community and the Council on Linkages. And it's my pleasure to welcome everyone to today's Academic Health Department Learning Community webinar. Go to the next slide. I think before we begin, I'd like to ask Janelle Nichols to go over some of the housekeeping items that are associated with the GoToWebinar software we're using today. So Janelle?
Thank you, Bill. Just as an FYI, all attendees on the call today are muted. If you are called in using your phone, please choose the phone call option in your control panel. And if you've chosen to use your computer mic, please use the computer audio option. The slides for today's presentation are available for download in the handout section of your control panel. And please do feel free at any point throughout the meeting to use the questions panel to ask questions or submit comments at any time throughout the meeting today. And we will be recording today's meeting, and we'll make sure to archive that and make it available following the meeting. And back to you, Bill.
Very good. Thank you, Janelle. Well, some of you on the call are new to us, so I'd like to fill you in just a bit about our learning community background, just so you're aware of it. Our learning community is a product of the Council on Linkages between academia and public health practice, and we're staffed by folks from the Public Health Foundation. It's Janelle Nichols and Kathleen Amos predominantly. The Council, as you can see, is made up of 22 different national public health organizations, including CDC and HRSA, and our funding, for which we are obviously very thankful, comes principally from the Centers for Disease Control and Prevention. We have three major goals as an organization. They're listed on the slide for you, and since you can download these slides, I'm not going to read them to you, but you'll note that all of them are related in some way to linking academia and practice. And we're often asked just what an academic health department actually is. A wide range of agencies, institutions, and arrangements are involved in these partnerships, making a tight definition difficult and perhaps really unnecessary. So this slide contains some of the phrases we use to describe these arrangements, and we present them here in the hope that they may be helpful to understanding and perhaps useful to you. The Council on Linkages is perhaps best known for its work to develop core competencies. So if we go to the next slide, Janelle. And these core competencies for public health workers, as I said, are probably the core work of the Council on Linkages, or at least what it's known best for. But the Academic Health Department Learning Community is one of our newest efforts. The learning community is now in its 7th year, and our activities are noted in the bullet points on this slide. If you're not a member and wish to join us, we'll have information for you about how to do that at the end of the session. And if we go to the next slide, just a list of some fast facts for you about the learning community. When we were established, we now have over 700 members. We've gotten to the point now where we hold a meeting every other month. And of course, we have a listserv for communications, a mentorship program, and technical assistance, as well as additional resources that may help in forming partnerships formally. Today, our speaker is Dr. Paula Masters. We're pleased to have her from the East Tennessee State University College of Public Health. And Paula, I'm delighted to hand the program over to you at this point.
Great. Hello, everyone. I hope that I am coming through properly now. I realize that I'm not as technically inclined as I thought that I was. I'm very excited to be able to just talk with you today and show you the things that we have going on in Northeast Tennessee. Janelle, if you will, please advance the slide. Thank you so much. So today we're going to be going over the academic health departments that we have in Northeast Tennessee. If you'll advance, please. So our academic health department model, framework, and plan all came out of this goal right here, which is obviously, just like Bill had said, the goal for all academic health departments was to bridge the gap between academia and practice. And, you know, we do that in a number of different ways, but really primarily through linking students with public health organizations for long-term field placement opportunities and continued collaboration. That looks different where across the board, but all with that same goal in mind. Next slide. The benefits of the AHD that drove us to the model which we'll use, which is a little bit different, I think, than other models that are used across the nation, but of course was when we were thinking about what do schools of public health need, and then of course what do our local health departments need. Here in Tennessee, we are a hybrid governmental public health model in that we have centralized and decentralized. And so with that, the services that are provided across the state are a little bit different depending upon each area. All, of course, with the 10 essential services in mind, but the actual implementation and programmatic areas are different. But we wanted to keep it based into just what exactly do governmental local health departments need. So the schools of public health, we know that we need really foundational practical experiences for our students, and that's at all levels. That's at undergraduate, grad, and doctoral, and then also opportunities for our faculty to incorporate practice-based research, in that allowing those really real-time organic pieces to come out and be have that practice infusion in those. And then our local health departments, they need increased capacity to conduct ongoing assessment and support for program innovations. But that is just the overarching of they really need assistance and increased capacity for the 10 essential services. As all of us know, we are, as public health practitioners across the nation, we are continually tasked to do more and more work and provide more services at continued reduction in funding for those. So this is even more a timely framework to pursue. Next slide. So our academic health department, it came about from, like I said, that same goal that everyone does. However, it also came from that we wanted to develop a model that was a little bit different and also satisfy another need that we needed here at our college, which was we wanted to provide a practice track for our doctoral students. So more of a student leadership model. Our partners that made it possible for this, for our academic health department, of course, our College of Public Health. And then another one was our Tennessee Public Health Training Center. So at the time that the academic health department was created, here in the College of Public Health, we housed the Tennessee Public Health Training Center. It was the only one there in Tennessee. And that's when the Health Resources and Services Administration funded public health training centers were on a state-by-state model. Since that time, that structure has changed in that the HRSA-funded training centers are now on a regional model. So LifePath, the Tennessee Public Health Training Center, still is in operation, but it is a performance site for the Southeast Public Health Training Center, which is housed at Emory. So still maintains the partnership and its role in the academic health department, but just with a different umbrella of oversight, which with that actually comes increased capacity for some academic infusion and allowing the Tennessee Public Health Training Center to work with all the others in the Southeast, even in regards to the academic health department. Our academic health department started with the Sullivan County Regional Health Department. The Northeast Tennessee is divided up, like I was talking about with the decentralized and centralized. Our 8 counties of Northeast Tennessee, we have representation of a metro health department, which is more of an urban health department that oversees all of Sullivan County. That includes 2 urban areas, Bristol and Kingsport. And then Northeast Tennessee Regional Health Office, that is a rural regional health office that oversees the other 7 rural counties. Our academic health department began with Sullivan County, and then we added an additional MOU with the Northeast Tennessee Regional Health Office. So that way we would have a partnership in place for an AHD across all of Northeast Tennessee. Next slide. This is that service area that I was just referencing, that there are 95 counties in Tennessee, and it's broken up into 3 grand divisions, but within each of those are smaller service areas. And there you can see indicated with the circle is our catchment area for service for our academic health departments, with 2 academic health departments, 1 being in Sullivan and 1 serving the other 7 counties there in Northeast Tennessee. Next slide. So this is our framework, is that, like I said, we wanted to move forward with the partnerships, but do it with a little bit different model. So we wanted to have it where students would develop practical leadership skills in the health department while enhancing that capacity at both of those sites, and also making sure that we were serving our community and our stakeholders. So that was very important too, is that not allowing this to be only a partnership between practice and academia, but making sure that the projects, the service, the research was still responsive to the stakeholders and the community from both of those entities. So our advisory committees at the college and our health councils and other community groups from the health department sites are also involved in the academic health department to make sure, like I said, that we are serving the needs of our external partners. Next slide. So this is how it began. So this guy looks a little confusing, but I thought that it was very important to show this, is that this is what we put together when we first started in 2012. So we started with the Sullivan County MOU in 2012, and then added the Northeast Regional in 2013. But this is how it started. So there, let me go ahead and explain these components, and then the next slide will show now how it's morphed into something else. I think that with everyone is that you start with a certain model, and then you allow it to be very flexible and fluid to make sure that you are responding to the needs and to your partners. So this is our model. The SCHRD, that's the Sullivan County Regional Health Department, and then of course ETSU College of Public Health. Those were the 2 entities that came together to create the Academic Health Department. Again, keep in mind that this is a student leadership model. So therefore, we wanted to make sure that everyone involved was benefiting. And we knew that we wanted the students that were going to be acting as the academic health department coordinators to maintain mentoring, both at the academic site and at the practice site. So that's another component that comes out and drove the development of what you see in front of you. So the leadership position at the health department was the health director there, the county health director. And then for the College of Public Health, it was the principal investigator of the Public Health Training Center at the time. And then under that, you have the point of contact that served as the liaison at the health department, and also a practice mentor to make sure that someone was handling that cultivation of that student there with those practical skills. And then replicating that on the academic side. So the identification of an academic mentor that served over the student and helped guide them with trying to align what they were doing in the classroom and in research with what they were what they were being able to do over on the practice side. And then the point of contact became the Life Path Program Director. And that was my position at the time. And then, as you can see, then it was the Academic Health Department Coordinator. And that was a DRPH student. Again, you know, our model was guided that we wanted to be able to provide a practice track for our DRPH that hadn't been there in place before. And so this was accomplished between taking a graduate assistantship and placing it there at the health department, serving as the academic health department coordinator. What they were then responsible for was to oversee master's and undergraduate students for field placements and projects and service learning. And then there towards the bottom right, you see that the Assistant Dean for Public Health Practice was the one that was helping when it came to the field placements, because the academic, on the academic side, that person was responsible for all of the placements for the college. Next slide. This is what it looks like now, is that as we started going through and after we successfully hired and placed our first academic health department coordinator there at Sullivan County, and then with the addition of the Northeast Regional Academic Health Department, things started to morph. We had some changes in leadership. We had some changes both at the practice side and at the academic side. And we had changes with funding coming from HRSA for the training center. And we started to see that there were students at the MPH level, that those high functioning MPH students that could also function in that role. And that with both those and the DRPH students, with the strong vetting process that they had to go through the interviewing and with the application of their skills and looking at those to see if they were a good fit for the coordinator position, that it was very feasible to have an MPH student actually serve in that role. So that's how it's indicated. So what you see there is there in the yellow boxes, you can see the differences, and along with the arrow, which I want to explain a little bit more, is that there you can see that we added the additional site. So the Northeast Tennessee Regional Health Office there at the top left corner. And then what we saw there at the practice site was that the point of contact and the mentor actually, it became the same person. It was much more around, it didn't make sense at the sites to have two different people functioning in that role. So that became one position, that the point of contact is the mentor for that student there at each of the sites. Like I said, we saw that it could be an MPH or DRPH to serve in that role for the graduate assistantship. And then instead of it being an assistant dean of practice, in which unfortunately that position was affected by one of our faculty members passing, and that position was then changed into two field placement coordinators. And those are the folks that are involved now at that level. The arrow, what that shows is that because of the reduction of funding from the health resource through HRSA, and the way that they handled that, like I alluded to earlier, is that the public health training centers got changed into a regional model. And so with that, there were much less funds coming to each of the states. Therefore, there was no principal investigator and program director. That the program director, which was, like I said, myself at the time, I then took over the role and became the principal investigator. And so that has now been collapsed into one position. So the leadership position and the point of contact for the college is me. So I serve both as the Assistant Dean for Students here, which allows me to talk academic health department to all of our students, but also as the PI for the training center here, that allows me to oversee and the academic health departments. Next. So lots of changes happened, but very good changes. It allowed streamlining of processes and allowed us to have more sustainable structures, which were a good thing. And even though it was painful at the time because it was due to reduction in funding and the loss of some positions, at the same time, it allowed us to create a really concrete foundation here for our academic health department. So what do our coordinators do? Our academic health department coordinators, there's three overarching pieces to the position. So, of course, they collaborate with academic and practice supervisors on research development. So like I was talking about before, is that they serve as that liaison. So as things are coming out of practice that would make really great research projects or that need faculty infusion and student infusion, that liaison, that coordinator is able to bring that conversation here to the college. And then of course, vice versa, that as faculty are looking to conduct practice-based research, or they're looking to construct projects inside their classrooms, that liaison then takes that back to practice. And so it becomes this really great bridge, this open door, or excuse me, swinging door, where all this information exchange and skill exchange is allowed to happen through that collaboration. They also provide project management to both of the sites. So as those projects are developed, is that then that academic health department, because they do have that information and because they were involved in the construction, is that they can then serve in a management role, is that they can oversee that. They can make sure that there are students available, that tasks are being accomplished, and that those pieces are moving forward. The other overarching is supervision and mentorship to the public health students. So our academic health department coordinators, even though they are a student, they still supervise those students who are conducting field placements. So at the doctoral level, if the academic health department coordinator is a doctoral student, they can oversee master's, doctoral, and undergraduate. And if it's at the master's level, then they are able to oversee master's and undergraduate. So if it is a master's student serving in that role, they do not serve in a supervisory role for the doctoral students. That's actually accomplished through their preceptor. Now, with that said, there is still a preceptor at each of the practice sites for every student. And that is so that way that the academic health department coordinator is not the only one providing mentorship and guidance to these students, that those practice leaders at each of the sites that are involved in the day-to-day and in the programs and the projects are still also precepting these students. Next slide. So the benefits for the academic health department coordinators, they gain leadership experience through all of those. So when we placed our first academic health department coordinator, that first GA, the amount of feedback around the leadership experience they had was invaluable. And we've operated off of that from the beginning, is that we wanted to really have this rich leadership experience for this student and allowed them to use, like I said, their GA to accomplish that. And they do it through project management. Coordination of the local health council was one of the responsibilities. That health council since has changed into a different sort of group, but the still coordination is part of that part of that benefit. And then the day-to-day facilitation of those students, again, is another benefit to that leadership experience. Next slide. What are the benefits for the actual students that are being placed at these sites that have the academic health departments? Well, they get real world experience, just like they do in any of the field placements, but it's really great when it's through an academic health department, as everyone who has an academic health department in place, because those projects have no gaps. Those experiences have no gaps because you already have that bridge, that infrastructure to where they can come straight in and everything is really more streamlined. There's a reduction in onboarding, and it seems that more can be accomplished when you do have an academic health department in place. There's increased availability and access to opportunities when the academic health department is there, so students have more options available to them. And then it really does allow for improved practice-based education for all of the students that are involved. Next slide. What about the faculty? I don't know about the rest of the community, but this is the question that I get probably most often, is what are the benefits to the faculty who are involved in an academic health department? Well, there's a huge increase of availability of student assistance. So now, no matter if it's research or service or for the class projects, that when you have an academic health department structure, and for us, we see that this is especially important and beneficial when it's a student leadership model, is that you just have more availability of student assistance on all of that. Because having a student allows for there already to be sort of this word of mouth, this peer-to-peer communication that allows for the rallying of other students onto projects. The academic health department coordinator is available to help develop and manage these programs. So as I was talking about before, is that because they're involved from the beginning, they can assist the faculty in the development and talk about how that meets a need out in practice, or talks about something that they may have seen previous. So they allow to really become a really guiding factor to some of the development. And then they provide the assistance on placing the students. So, we see all too often that placing students becomes quite burdensome. And so having someone in that role really helps to assist those faculty in concentrating more on the advising piece and the construction of learning objectives and securing competencies for that faculty role in that field experience, instead of it being on trying to figure out where to put the student and what are some projects that they could be doing. Next slide. But what about public health professionals? So there's a constant circulation of students through all of the sites there through the academic health department. Having that is great because then they have increased manpower. The increased capacity that gives allows for public health professionals to take on some new initiatives that they may not have been able to do before, because now they do have an increased workforce and increased assessment capabilities and analysis capabilities and so on. And having someone that is there serving in that role that's available to help develop those programs and manage those programs allows those professionals to get back into other things that they may have had to put on the back burner to take this. Is that it's such a complementary piece to be able to have someone in that position that can assist them with their workload. Next. And then the community benefits. And it allows for a more knowledgeable future generation for public health professionals. And it allows for students to offer that insight and assistance. And then eager talent, having that constant string of students through there is just really instrumental in being able to have this energized piece coming to all the projects coming out, and it being a student leadership model even furthers that, in that you have these fresh minds on with a completely different lens than I have and than others have, that are able to provide this guidance and the feedback and such relevant information to all of the projects that come underneath the umbrella of the academic health department. Next slide. So what are some of the activities through the academic health department? This is obviously not a comprehensive slide, but I thought it was some that I could show you that is going on. Health council facilitation. So all of our counties, all of the 95 counties in Tennessee have a health council, and those are facilitated through support and manpower through the Tennessee Department of Health. And the academic health department coordinators, those students, are involved in that, and they help to either facilitate those health councils, or they absolutely at minimum serve as a member, and so they're involved in that, and so that way they get direct infusion out into the communities and the stakeholders. Our academic health departments have, especially in Sullivan County, have constructed the community health needs assessment for the health department. That was a huge undertaking, and the product is sensational. Emergency preparedness projects, as all the public health professionals know, that those emergency preparedness pieces, that having increased capacity and manpower for those is key, and that's been one of the largest projects that have been taken on by the academic health department. Of course, job shadowing and field placements, and then through the AHD, they created a college and practice network and a couple of events under that brings in both the sites and the community stakeholders to allow just a time to come together and find out what everyone is doing, and just really maintain that relationship between all involved. And then professional development for students. So because they're located out in practice, these student leaders, these academic health department coordinators, they get to see what professional skills are needed, and they bring that back and have constructed professional development skills training for our students here in the college. Next slide. Obviously, even though that I think that our model is great, and I am a firm believer in just academic health departments in general, there are always things that we can do to improve. Just continued faculty buy-in is that the academic health department is becoming almost a default when they're starting to think about research and service, is to allowing the academic health department to be a platform for that. Plugging in the coordinators into school-affiliated research projects, so not only having them help to oversee, but truly using their talent and writing them into research. Just more projects in general, so just being able to get them more involved. However, I have to say that I don't even know how that would look at the present workload that they're experiencing right now. Utilizing these coordinators in all of the student placements. So because they are at each of these sites, is not only using them to place the College of Public Health students, but possibly the other students that are coming into these sites, such as the registered dietitian students or the med students, and so on. So that way we can really think about interprofessional practical experiences going on at each of these sites. That these coordinators be able to come to more department head or leadership meetings, so that way they can get even more face time with the leaders. And then, of course, what we all always say that we can use to improve anything is additional funding. Last slide. And that's it. I've gone over time. I do apologize, but now I just want to say again, thank you for allowing me to present the model we have in Northeast Tennessee for academic health departments, and I open up to questions.
Thank you indeed very much, Paula. This is Bill again, and let me just repeat for everyone what you've heard before. Please type your questions in so that we can get them to Paula. And I wonder, while we're waiting for some of those questions to appear, well, I'm wondering, first, how many health departments are associated with the College of Public Health? And that's just a short answer. But I'm really interested in where the impetus came, or where the push came to develop this concept. Did it come from the College of Public Health? Did it come from some practice settings as well? Just how did it all get started?
Absolutely. So let me hit the first question, and that when we're talking about just affiliations with the college for the academic health department, is that we have memorandums of understanding with the 8 counties, and that includes all of the health departments within those 8 counties. So when it comes to actual health departments, local and regional sites, that's 11. And then we also are affiliated with the other academic health departments that are in Tennessee. So the first academic health department in Tennessee was not through ETSU. It was actually through the University of Tennessee, Knoxville. Dr. Irwin, who's a member here and who has presented here, he started the first one, and so we're affiliated with them also. And then as part of the training center, is that after we established the MOU, the academic health department with the Northeast Regional Health Office, we then worked with the University of Memphis, their School of Public Health, and the West Tennessee Regional Health Office there in the western part of the state, which is more towards the Memphis side, and we helped to secure an academic health department with them through our training center here. So that's the service sites. Where did this come from? So it was from the college, and that they had wanted for a long time to have a more streamlined field placement process. And then with the addition of, when they secured the training center, the public health training center, was then we started coming together to talk about how could that work? How could we have a more streamlined field placement process, and how could we provide more of a student leadership experience to and at that time it was to our doctoral students. And so then we started looking in, and one of the ideas we had, well, why don't we do an academic health department and use that already established infrastructure with a lot of the pieces from the success stories of those that had done it way before us, using that as a foundation and building off that and just creating sort of a new implementation model for it.
Thank you. Kathleen, do we have any questions?
Yeah, we have a question about the coordinators. So how many coordinators do you have? And does each work with just one student, or are they responsible for several students?
That is a fantastic question. We have a coordinator at each of the regional sites. So we have a total of 2. We have one located for the Sullivan County Regional Health Department, and we have one located for the Northeast Regional Health Department. And they oversee all of the students through the College of Public Health that are conducting field placements at any time. So sometimes they may oversee 2, and at one point we had a semester where one of our coordinators was overseeing 11. So it fluctuates.
Great, thank you.
Absolutely.
That is all we have in the chat box right at this second, but we will obviously give people a few minutes to type questions. So just as a reminder, feel free to type your questions in and we'll read them out for you. Or if you prefer, you can also raise your hand and we can unmute your phone line so that you can ask your question that way as well.
While we're waiting, Paul, this is Bill again. I might ask another question. I'm
Absolutely.
interested in where I'm interested in the practitioner side as well, and I wonder where your major champions are in practice.
Um, for the academic health department or just in general?
Well, no, I'm thinking about the academic health department. In order for it to work, you need to have people within the departments, of course, who support it,
Yes.
facilitate it, etc. And I'm just wondering how large that cadre is and how you connect with them. How do you keep them involved?
Absolutely. That's actually a really great question. So, going back to the slide that showed our sort of organizational chart for this, it was very important for us to have involvement, first and foremost, by the actual director at each of the regional sites. And so we wanted to gain their buy-in and before anything else. And so we did. And so and that was key to success because they serve as the leadership role, as the primary champion to take this on. And, they're named in the memorandum of understanding that they are charged, just as I am here, with the success of the academic health department. And then they have done a great job and then taking that to their leadership teams. So their program directors and then like the Northeast where it serves 7 counties. So other county directors, they have taken those leadership teams and they have had them start speaking academic health department. And now, since we're here in 2017, is that, the entire network there has seen the benefits of this. And so, first they may have been just told to be a champion, but now they're voluntary champions because they have started to see this. And so, we've been very lucky in that when it comes to buy-in and securing champions, knock on wood, we haven't hit any barriers with that. So, it came from the top and then successfully trickled down without question. But again, I think you have to make sure though that you do deliver so that way they believe in what they are championing.
Mm-hmm. Do you offer them any sort of position at the school?
That's a great question. And that is something some of our practice folks are faculty here in our college. However, that was already done. That's not been done through the academic health department. And that is something that we have the conversation about all the time, is how to make that happen under the AHD umbrella. It's funny that you even said that. We even talked about that this morning at one of our meetings, is really trying to have that happen more. But under the AHD umbrella, no, that has not happened.
Mm-hmm. Thank you. Kathleen, any additional questions?
Yeah, hi, this is Ron Bialik at the Public Health Foundation. Great presentation. I have a question for you about potential involvement of others outside of the College of Public Health from East Tennessee State University. And what I'm thinking about, specifically, or as we in public health continue to move towards addressing social determinants of health, there are other departments and faculty and students who are working in areas that could get to that. Is there involvement or a thought of involvement of other departments within the AHD?
That's a great question. So not formally, however, here at ETSU, we do have an academic health science center, which includes the College of Public Health, the College of Clinical and Rehabilitative Health Sciences, the College of Nursing, the College of Pharmacy, and the College of Medicine. And there is a working group under that umbrella, and I actually serve on that committee. And that is definitely a way that I think we would be able to already have sort of this pipeline to involve the academic health department in that more interprofessional connectivity. It hasn't been done yet formally. However, because I am involved in that, is that I've been able to talk about the academic health department and put forth its model to my partners through the academic health sciences. And we do a lot of training for our students in all of those 5 colleges together. And a lot of times we host those in the College of Public Health, and being able to bring in practice folks and students and community members, we did leverage the academic health department to do that. So it's something that is done. It's just not been done formally. However, you saying that makes me realize that I need to move forward with trying to make that more of a formal piece.
Thank you.
Absolutely. That's a great question.
Excellent. This is Kathleen again. Paula, I know Bill asked a question about champions and how important champions can be. Are there other elements that you found really critical when you were trying to get all this work off the ground, in terms of things that you either had in place at the school or at the health departments already, or needed to build? Or I guess what I'm getting at is, do you have any kind of tips or advice for people who are maybe starting out with this and trying to figure out where to go?
You know, I would say we were very fortunate in that even before having the academic health department, we had such great working relationships with our health departments that this was such an easy implementation. That what I would say to others is that if you haven't yet figured out to really create just a great working relationship with local, regional, and state public health folks, is that do that, because that benefits you even outside of the realm of the AHD. And then should you move forward to try to create an AHD, is already just going to grease the wheels and things are going to go so smoothly. The other critical piece is, I think, sort of in the same vein, but involving those practice folks in what this could look like to make sure that it meets everyone's needs as it's being framed up. So as an academic institution, don't build it and then take it to them and say, what do you think? Is that allow for it to truly be this just great organic process that everyone that's going to be affected by it is involved from the start. And that I think those 2 pieces alone. So
great, thank you. It doesn't look like we have any additional questions at the moment, Bill, Paula. So if you want, I know, Bill, we have a little bit of wrap up stuff at the end. I'm happy to keep an eye on the chat box. Please do continue to send your questions in if you have them, and we can try to address them before the call ends.
All right. Well, let's do some of the wrap up and come back. And again, our thanks to you, Paula, for a really nice presentation, and thank you for being so thorough in your response to the questions. I think it really helps us understand what's going on there. And of course, we know about Dr. Irwin and some of the work that he's done as well, and we understand the State Health Department is a good partner in all of this also. And I think it's going to be a theme of the fall Tennessee Public Health Association meeting. At least there'll be some sessions there about this. Well, for those of you who may have questions about how to begin or sustain academic practice partnerships in your own communities, you might find our mentorship program of some interest. If you have knowledge and experiences you're willing to share, then please consider signing up with us as a mentor. We're always looking for new folks here. And if you would like some assistance in what you're approaching, then don't hesitate to check with us about the possibility of becoming a mentee. That is, of having the opportunity to work one-on-one with someone who has real expertise and experience in the area of concern that you're dealing with. And you could also use our listserv to make inquiries of our general membership in the Academic Health Department learning community. And we'd be glad to help you, we'd be glad to facilitate that for you if you think that might be helpful. And the next slide then, please. I would also encourage you to take advantage of the additional resources we have available by accessing the tools on our website or connecting with our staff about questions you may have. And the slide shows you some of the staff connections and also some of the website addresses that may be useful. We've also begun an Ask the Expert column. And so if you have questions about academic health departments that you think might be best dealt with there, please feel free to send a question to us, to Kathleen Amos, and we'll try to do our best to get answers for you in our column. And on the last slide, it just provides some information about other resources available through the wonderful Public Health Foundation. Do such a terrific job not only in supporting the Council on Linkages and the learning community, but many other activities as well that support the learning and the practice of public health professionals. So remember, these slides can be downloaded, and if you'd like to keep them or pick a few that you want to keep in order to have these resources easily available to you, you can certainly do that. So, Kathleen, have we gotten any other questions?
We do not. I think we're good for right now. And I will just add, Bill, you mentioned the slides. People can hold on to them. We did also put the slides up on our website, and the archive of today's meeting, the recording, will be available on our website as well, and we'll make sure that that gets sent out to everyone, as Janelle mentioned at the beginning.
Mm-hmm. Excellent. All right. Well, Paula, once again, our thanks to you for taking part in this webinar today. We appreciate it very, very much, and look forward to meeting you as things go on here. And so, there are no more questions at this point, then I think we can bring the webinar to a close. Thank all of you on the call for attending and working with us. So thank you so much, and that will end the webinar.
Thank you.